Hi, my name is Merrill Staten, and I live in Olathe, Kansas. My question is for all of the Republican candidates today. I am 33 years old. I live in Olathe, Kansas. I have a neuromuscular disease called Charcot-Marie-Tooth disease. I was diagnosed with it when I was 17. Basically, it's kind of been dormant, I guess. 2 years ago, I had a son born with cystic fibrosis. At that time, the stress caused it to come out. I've had a lot of progression. It's all I can do to stand some days. I get around with braces on my legs, scooter that I just had to pay out of my pocket for. I have no health care. Between me and my son with cystic fibrosis, we both have two progressive diseases. I'm looking at becoming a doormat over the next years with no arms and legs, and I got a son, like I said, he's got an average lifespan of 36 years right now. We do breathing treatments twice a day that are about an hour long. Between the two of us, our medications cost up to $10,000 a month sometimes. I have no health insurance. The government won't allow it to me because the disability I get, it's called Title II here in the state of Kansas. It's money that I've paid in, like a Medicare, Medicaid type thing. It's money that I've paid in. It's my money that I've paid in. They're giving it back to me in the amount of $1,900 a month. That $1,900 a month makes me not qualify for any sort of government aid. $1,900 a month is more than I'm supposed to be able to get for a family of four. I've gone to them, I've talked to them about it. They've told me they've given me the standard deductions. Those standard deductions include a mortgage payment of $317 a month. Even though your mortgage is more than that, we understand that's what the government allows. That's what they've explained to me. I've talked to them about food stamps or any sort of thing like that, any sort of other thing. If you can't make more than $623, and if you do, for a family of four, it disqualifies you for SSI. If you are eligible for SSI, you are then also possibly eligible for food stamps, which is the maximum amount, I believe, is $258 when I spoke with them, but I'm not eligible for it. So the IRS will tell you that a family of four, they allow a family of four on average spending to be $997 a month at the grocery store. But yet our government is going to tell you that as long as you don't make I believe it's $623 or $643 a month, then they will give you the maximum amount of $258 a month to help you with the groceries. So we're going to tell you that the IRS that you're going to spend $1,000, but yet when we want to help you, quote unquote, we're only going to give you 25% of that, and that's only if you make less than $623 a month. So I'm 33 years old. I've closed my trucking company. I've lost everything. I'm currently carrying $60,000 of old debt from my business. I've got two credit cards that have a minimum payment of $1,000 a month on them right now that are left over. Just got a bill yesterday from my son's last admission at the hospital, which is $10,000. We're really seconds from being on the street. I'm blessed to have two wonderful children and a wife that loves me. Although we struggle every day because she's scared of her future. How is she going to take care of a husband with no health care? At some point, even though it's hard now, at some point I will no longer have any use of my arms and legs. And I have a son that's got a median life age of 36 years right now, and that's in good health, doing 2 breathing treatments a day and $6,000 or $7,000 worth of medicine a month. So my question is twofold, and that's how are you going to change the care that is provided for people like myself when I go down there and they tell me that we're dealing with taxpayers' money and we have to make sure that you're eligible, even though I am a taxpayer and it's my money that I'm getting back, I'm not eligible for it. And the limits are ridiculous. And why does the IRS say $1,000 or $997 for a family of four at the grocery store, but we're only willing to give you $600 or $258? I mean, we're only going to give you 25% because we really don't want to help you. The second part of that is, what are you going to do about health care? How does a person like me and my son that are both, spending at times $10,000 a month on prescriptions alone, not counting any of his hospitalizations or anything like that, or any stair lift that I had to pay out of my pocket or my scooter that I had to pay out of my pocket, How are you planning on fixing the healthcare system so that a person like myself that can't afford healthcare, what am I supposed to do? Because I can tell you right now, like I said, we're seconds from being on the street. Thankfully, my wife and I have a good relationship and have not divorced. And, we made a pact and we're going to make it through this no matter what. But the system is broken and needs to be fixed as far as healthcare and helping people who need help. And I'd like to know what your plans are on both of those. Thank you for your time.